Hi, I'm Dr. James Machino. Dangerous supplements for erectile dysfunction and impotence. Erectile dysfunction is defined as a consistent inability to obtain or maintain an erection for satisfactory sexual relations. Then there's complete erectile dysfunction, which is an inability to have any penetrative relations at any stage. So this is more like, serious impotence problems when you get to complete erectile dysfunction. How common is the problem? Well, 50% of men by the age of 50 have some degree of erectile dysfunction. They certainly aren't the men that they were when they were younger. That's how they report it. And by age 60, 75% of men now report some level of erectile dysfunction. And so, it's a big issue. There have been drugs that have been created to help with this. But there are some natural herbs that are proven to be useful that can improve sexual performance and even libido. However, what I want to point out in this video is that some of the herbs and substances, even though they're natural, are actually quite dangerous. So here's a list of the ones that are dangerous that should not be included in any male virility supplement or even female libido enhancing supplement. Make sure these agents are not in there. The first one is yohimbe. So yohimbe contains naturally these alkaloids which have been shown to increase blood flow or open up the blood vessels, vasodilation, and bring more blood to the genitalia. So that gives you a better erection. But it does it via its effects on the central nervous system. And so by stimulating the central nervous system, it's produced some very bad side effects. Anxiety, panic attacks, hallucinations, high blood pressure, tachycardia, a racing heartbeat, dizziness, headaches, skin flushing, aggravating kidney problems, and making worse certain psychological issues. So the Food and Drug Administration has classified yohimbe as an unsafe herb that can only be taken under the supervision of a medical doctor. There is yohimbe available over the counter, but the Food and Drug Administration makes the companies take the active ingredient, the alkaloid, out of the herb, and it's the alkaloid that actually gives the erectile dysfunction benefit. So in order for yohimbe to work, it has to be a 6% grade of yohimbine, which is the alkaloid. And that's been useful for about 34 to 43% of erectile dysfunction cases have been shown to improve when you're taking the right dosage in that standardized extract. But the over-the-counter yohimbe has had the alkaloid removed, so it's totally useless. On the other hand, if you get yohimbe that has the alkaloid in it, which is sort of more of a prescription product, it can be quite dangerous. So I wouldn't recommend it because there's other things that work really well. You don't need to put yourself at risk. The second dangerous supplement is ginkgo biloba. Ginkgo biloba has had a good success rate with men that have erectile dysfunction problems because it opens up blood vessels, so more blood flows to the genitalia, and it's an anticoagulant, so blood doesn't clump together, so more blood can create the engorgement that you need for a good erection. So it's been especially helpful for diabetics because they tend to have vascular problems, and also men who have erectile dysfunction due to high cholesterol levels where the vessels are clogged up with plaque. The problem is that there have been reports of individuals using ginkgo biloba who had internal bleeding problems, bleeding into the brain, subdural hematomas, because the anticoagulant effect is so great that sometimes if a small blood vessel breaks, the blood can't clot in time. Now you start having internal bleeding, so it's quite dangerous. It's even more dangerous if you happen to be on a blood thinner or an anti-inflammatory drug. You know how a lot of doctors put men and women after the age of 50 on an aspirin a day to thin their blood? You add ginkgo biloba to that, then you're a bleeding disorder waiting to happen. And a lot of people today are on Coumadin, warfarin, Plavix. They're taking aspirins, ibuprofen, indomethacin, Voltaren. And these things all have anticoagulant effects. You cannot combine ginkgo biloba with those things. There's a great chance you're going to bleed, and some of the bleeding has occurred in men who are not even taking those drugs. So I'm not a big fan of ginkgo. The third dangerous one is ginseng. Ginseng does a really amazing thing. It looks like it can release nitric oxide in the blood vessels around the genitalia, and that's what eventually will help to cause vasodilation and reverse erectile dysfunction problems. So studies have shown that at a dose of 1,800 milligrams a day, the right grade of ginseng can improve erectile dysfunction problems really well and also even improve libido. But ginseng messes up a lot of other drugs. If you're on any other medication, ginseng, the way it affects the liver and the liver detoxification enzymes, it interferes with the metabolism of antidepressant drugs and other mood-altering drugs, and it's produced mania responses in people. It can also counter the effects of anticoagulants. Let's say your doctor's trying to thin your blood for whatever reason, and you take ginseng, it's going to speed up the detoxification of the blood of warfarin or Coumadin, Plavix, whatever the drug is, and it's going to then change the effect of the drug on your body. And so there's all kinds of drug-nutrient interactions that we worry about whenever ginseng is added. So if you're on any medication at all, ginseng's pretty much off the list of things you can take. The next supplement that's dangerous in my view is called cordyceps. It's a mushroom that actually grows on the back of caterpillars at high altitudes. So, but it's used as a supplement because it has some medicinal value. It's been used as a sex enhancement virility supplement, and it's been shown to work in conjunction with some other agents, improving erectile dysfunction by up to 34% in clinical studies. But again, cordyceps is a powerful anticoagulant. It could lead to bleeding disorders, and it may interfere with mood drugs. So those are the dangerous supplements to stay away from. On the other hand, there are some natural supplements that work really well. They're completely safe. They don't cause bleeding disorders. They don't have drug-nutrient interactions, and they reverse erectile dysfunction problems really well. So the really good supplements are a supplement that combines these herbs: Tribulus terrestris, Muira puama, Epimedium, Damiana root, Avena sativa, Maca root. When you put those together, you get great synergistic effects that have really helped with men's sexual performance ability by increasing blood flow to the genitalia, increasing sensitivity of the genitalia for easier arousal, and increasing libido and sexual desire. That combination even helps women. It's been shown to increase their sexual appetite and to allow them to reach orgasm more easily. So those same herbs that I like also are useful for women who have libido and sexual performance issues as well. And there are clinical studies to show that. But stay away from the dangerous herbs that I've pointed out to you in this little video. Now, I've explained all of this information in a little e-booklet that I created that's available right here. It's called Effective Natural Remedies for Sexual Performance, a guide for men and women. So if you've had any sexual performance issues, whether you're a man or a woman, you should really download that ebook. It'll show you exactly what you can do that's natural, that's effective, that's safe, and how to avoid things that are not safe. You should really download it now if this is of any interest to you at all. Now, at machinohealth.com, you'll see my other published review papers. You'll see other videos I've created, footage from my live professional seminars, other downloads, resources that I've put there that will help you lead a long, healthy, functional life. All my research papers and my teaching materials are complete with all the scientific references, so you know you're getting only sound scientific, evidence-based information from me on any health topic that you're looking for. So you really should make machinohealth.com an ongoing, reliable resource for health and wellness information for both you and your family. Thanks so much for watching.